Sherry might seem like an average middle-aged cosmetic surgery patient, but her story has a twist. By the time she was in her mid-30s, Sherry's weight had reached several hundred pounds. Dieting and exercise became a permanent part of Sherry's lifestyle. The results were impressive. She lost nearly 80 pounds.
After I lost all of the weight and did the exercise program, the very disciplined exercise program, there was still all this excess skin.
So despite her phenomenal weight loss, Sherry says her body was still not what she had hoped. This isn't fat, it's her excess skin following the weight reduction. Underneath this loose skin was Sherry's well-toned body. The question was how to reveal it. She went to see Dr. Patrick Maxwell of Nashville, an internationally respected aesthetic surgeon. Dr. Maxwell's recommendation? A very rare procedure called a total body lift, in which the skin is actually detached from the underlying muscle, then drawn up tight. A bit like having a suit taken in by a tailor.
And this is...
It's a buttock lift, it's a thigh lift, it's an abdominoplasty. It's taking all that stuff that we'd all like to throw away. All the stuff you can grab, front and back, thighs, buttock, and throwing it out the window.
Like most new surgical techniques that are revolutionizing cosmetic surgery, the total body lift relies on a thorough understanding of anatomy. Surgeons are moving away from the days of simply stretching the skin tighter. Some, like Dr. Maxwell, are becoming much more skilled at putting the skin exactly where they want it.
All right.
See you, buddy.
I'll give you a call upstairs when we get started. Okay. And I'll
See you.
give you a call.
I'll see you when you're transformed.
Cosmetic surgery can encompass a wide range, from minor tweaks to the total body lift, which is major surgery. And there are always medical risks. One of Dr. Maxwell's concerns is the length of time Sherry will be under anesthesia. Although patients are routinely put under for 10 or even 15 hours during major life-saving surgeries, this is elective surgery. His goal is to complete all 4 procedures in about 5 hours. The first step will be the sculpting of Sherry's thighs.
In regular or traditional liposuction, a metal cannula is connected to a vacuum source, and then when this is introduced into the skin, it sucks fat out purely by vacuums. In ultrasonic liposuction, a generator converts electrical energy into sound waves.
Yes, sound waves. For years, sound waves have been used in other procedures. Kidney stones are routinely blasted with ultrasonic frequencies. Not so long ago, some cosmetic surgeons began to ask, what would such sound waves do to fat? The ultrasonic waves quickly liquefy the fat, allowing a gentler and safer removal from the body. The area is also infused with fluid to lift the skin off the fat layer. So what took months and years to build up is gone in minutes.
And with no pressure, this is with my fingers. This isn't a rough liposuction you may have seen before. And look what comes out. Liquefied fat. Vanilla milkshake.
Liposuction is the most common cosmetic surgical procedure for both men and women, but it is not without controversy. The greatest dangers are infections and serious bleeding. These concerns can be lowered by first infusing the area with fluid, including a blood constrictor and anesthetic. Possibly, the most important safeguard is finding a board-certified surgeon like Dr. Maxwell. After the liposuction, a breast lift is next. The arms are then reshaped, and finally the eyelids are lifted. As each stage of her surgery is completed, Sherry is one step closer to a whole new body. But her doctor says it will be many weeks before she's healed enough to see the results, and months before all the swelling subsides. Dr. Maxwell has performed Sherry's surgery in a hospital setting, but an increasing number of procedures are performed in doctors' offices. While many office operating rooms are well staffed and equipped to handle emergencies, some are not. and no regulations ensure those safeguards for the patient. It has been 8 weeks since Sherry Hansen's total body lift. Today, she's returning to Dr. Maxwell's office for a follow-up visit.
Sherry,
Yes.
how are
I'm wonderful, and you?
Good to see you.
Good to see you.
You look great.
Thank you.
2 months?
2 months.
2 months. Any problems?
Not a one.
What size clothing are you wearing these days?
Mrs. Size 6 or 8 petite.
What did you wear before we started surgery?
Before we started the surgery, I was in a size 12, 14.
Each year, millions of people around the world have cosmetic procedures. In the past 5 years alone, the numbers have increased more than 150%. But beauty has a price. Tummy tucks, thigh lifts, breast implants, liposuction, and facelifts can range from $2,000 to $5,000 each. What's driving this willingness to open up the checkbook or hand over the credit card? The baby boomers are getting old, and they don't like it. In the 21st century, will aging as we know it exist? Or will advances in cosmetic surgery make the aging face and body a thing of the past? If there is a national epicenter of this youth-reviving trend, it is no doubt in the land of sunshine and movie stars, Los Angeles, California. Doctors Grant Stevens and Brian Kinney, both aesthetic surgeons in the Los Angeles area, know all too well the effect of the media on their business.
This is a tough town for people who are concerned about their appearance. Not only is this town driven by youth and the youth culture, but the pursuit of perfection here is as high as it is anywhere.
There is something that I have coined a phrase personally and talked about called the Baywatch body syndrome. Sometimes people want to look absolutely perfect in slow motion from any angle, practically naked. Now, if you take the people that we use as our role models, they may be born 1 in a million beautiful. They get hundreds of pictures taken of them. They choose the best one, they photo enhance it, and then the people in the line at the grocery store say, oh, I've got to look like that. That's not reasonable. Those people don't even look like that.
One of the first jobs of any competent cosmetic surgeon is to help the patient decide what is reasonable.
A patient who wants to have the change done immediately, who has only wanted to do it for the last few days or weeks, in other words, the duration of time they're thinking about it, that wouldn't be a good reason to have a life-altering or facial-altering procedure. And we want to know this is something that's been bothering them for a certain period of time.
Most doctors would agree that a well-informed patient is the first goal. There are 2 basic kinds of aesthetic surgery: redesigning a person's body and fighting the signs of aging. Each year, more non-surgical techniques are added to the list of weapons against aging. It's a war that might be summed up in one word: maintenance. Walk through the door of Grant Stevens' office, and it's a bit like walking through the future of cosmetic enhancement. Here, surgeons, dermatologists, and skin technicians work together in the battle. Most cosmetic surgeons agree that in the future, the fight against aging will begin when we are young. The first step, basic skincare procedures to prevent the wrinkles from forming. This might include exfoliating skin, that is removing the top layer. This dermaplane is basically a straight razor. The latest wave in exfoliation is the chemical peel, of which there are many varieties. The weaker chemicals may be applied by a technician, while the stronger solutions require a dermatologist. Even more high-tech weapons are available for the slightly braver age warriors. One involves injecting the frown muscles with botulinum toxin, or Botox, a derivative of the botulism bacteria, which in larger doses is poison. Dermatologist Molly Griffin says that there's been a rapid increase of interest in simple procedures such as this.
I'm about to inject this patient with botulinum toxin A, which is the same as Botox. Deep scowl for me. Good, okay.
The Botox begins working in the days following injection. It can be effective for several months. During that time, as various facial expressions are made, those muscles that repeatedly furrow the brow are motionless. No longer subjected to constant creasing, the skin doesn't wrinkle.
3 days, and the full effect is about